We'd like to remind you that if you are experiencing symptoms of a heart attack, stroke, or any life-threatening medical emergency, please call 911. Please do not delay seeking treatment during the COVID-19 epidemic. Most Providence emergency rooms are open, and CDC-required safety measures are being taken to protect patients and hospital staff. If you are unsure of your symptoms, please use our telehealth services and speak with a healthcare professional that can better assess your symptoms and provide direction on the best course of action. Please do not let the worry of COVID-19 cause delay in seeking out treatment if you are experiencing a heart attack or stroke. Every minute treatment is delayed can be fatal. Thank you.
Hi, everyone. I'm your host, Brett Barrow, founder and CEO of herfeud.com. As a reminder, the information provided during this event is for informational purposes only. If you have any questions around the COVID-19 pandemic, please visit our website at providence.org or visit cdc.org for their official medical updates. This event does not create a doctor-patient relationship, and any questions or medical advice discussed is not considered guidance on what you should do. For any medical questions, please reach out to your primary care or healthcare professional. Now let's begin. Joining me today during this event is Dr. Arpan Walgray, Executive Medical Director of Behavioral Medicine from Swedish Health Services. Hello, Dr. Walgray. Thank you for being here.
Thank you for having me, Brett. Yeah.
So can you give us all a little background about who you are and what you do for Providence before we get started?
Yeah. Sure. So I'm a geriatric psychiatrist by training, and I serve as Executive Medical Director for Behavioral Health in Swedish Health Services in Seattle. I also oversee the Telebehavioral Health Network for Providence across our 7-state system.
Oh, wow.
And have the privilege of serving as Chief Medical Officer for an organization called Wellbeing Trust that was created by Providence to advance the mental, social, and spiritual wellness of the nation.
Well, I'm sure that's really needed right now with everything that's been going on. So interestingly, I guess enough, Providence was the first, was kind of ground zero, whatever you want to call it, for the first patient in the United States to have COVID-19. So I feel like Providence is really sort of in a leadership position right now in terms of sort of guiding, other hospitals and kind of sort of leading the way across the country. What exactly is Providence doing for its caregivers and, to help them sort of go through this very unprecedented time?
Yeah, these are unprecedented times, and yes, like you pointed out, unfortunately, we've been faced with so much so soon earlier on, and have had to be creative. We're all learning, and every day we're adapting to what we're learning. I like the question a lot because I think when we think about everything we're doing, there's a lot of focus on all the things that are not there, but people who are on the front line of healthcare, so the healthcare givers, the support teams, there's enormous stress. I mean, you think about it, they're sprinting in what seems to be a marathon. And so you would expect physical and emotional exhaustion. So all the stuff that people feel are experiencing normally, so related to, the economy and social isolation, all that is there. But on top of that, these are people who are going into work every single day. And they're scared about getting infected themselves. They're concerned about transmitting the infection to their loved ones at home, infecting little children or elderly parents. And then on top of that, dealing with death and dying. I mean, this can take a very significant emotional toll. So we've from earlier on, we had been very focused on caring for our caregivers, and this just served as a catalyst for us to do more. A part of our approach to this is, caregivers, there are a lot of practical things that people need help with, and we need to make sure we're simplifying it. There were a lot of resources out there, a lot of wellness sites, and things that are very difficult for people to access right now. So we got a lot of feedback from our caregivers, from our frontline care workers, busy nurses, said that, I can't read another email on COVID. And, even if you want to give me resources to that, it's really hard. I'll get to it if things are really bad. So what we did was in an attempt to simplify things, we partnered with our digital innovation group and created an interactive tool, a stress meter. So,
Oh, wow.
and so what it is essentially using a well-established tool that already is there called subjective units of distress scale. So we use that and put that into a simple, easy to use tool. So it's like a 1 to 10 point scale. And what it tells you, so it gives you an ability to quantify the level of stress you're in right now. So when somebody, from our care teams takes that, they can quantify where they are. But then, well, more importantly, when they click on that, say they click on mild stress or moderate, whatever number they choose, then that opens up a series of things that would help them take care of their needs. So, one example is that we partnered. So right now, when you're stressed, you want some good information. A lot of people want to seek help on their own,
Right.
but then they rely on Google searches to get help. So what we did was we partnered with a group called Credible Mind. These are folks from UC Berkeley and Harvard. And what they did was created a curated place where you get the best information. So say you want help with stress and stress management, and your preferred medium of learning is, say, a podcast or a video. So you have the ability to put those things in that I want help with stress, and my preferred medium of learning is, say, a podcast. Then what you have happen is that the top 5 or 6 things that have expert ratings. So it's like a simple Netflix-like rating, a 5-star rating based on what the experts feel, so that you know that this is good content. And then also the users of the tool are able to rate their assessment of where it is, so people can use that. Then things like therapy. So people might not have the time to talk to a therapist. They might want to do it on their own. So we partnered with an Irish company called Silver Cloud, and they've built cognitive behavioral therapy tools, which are available 24/7 at no cost to any of our caregivers and dependents. But now through that link, you go in there. It's comparable to in-person care, and you're able to get the help you need. But then people might choose to talk to somebody, right? So then you go through the moderate or whatever it is, and you say, I want to speak with somebody in spiritual care. I want to visit with that. And then you have the ability to click on that link and you get connected with the spiritual care provider. And then one thing that happened with all this is that there's more, since our clinics closed down, we had more access. We had already been working on a behavioral health program for our caregivers, but now we were able to expand that. So if a caregiver or their dependent wants to speak with a behavioral health therapist, there's one number, you just click on that, they're able to go there, and they get same day access to somebody trained in cognitive behavioral therapy or interpersonal therapy. So whatever their needs are based on their preference. We've tried our best to simplify that. So this is, one of the things we've started. And then in addition, so this is still reactive, right? So somebody's feeling stressed and they want help. But then how do we bring help to them in their workday? How do we incorporate that? Not one more additional step. They're already overwhelmed. So through the course of the
tired too.
Exactly. So through their course of their workday, how do you build in things through the workday that allows for them to practice some level of mindfulness, gratitude, things that help people stay grounded. This is tough work, and these are tough times.
Right. That's incredible. I guess sort of based off of that, because obviously everybody working on the front line, I can't even imagine what it would be like to be in their shoes. And I think it's probably collectively for all of us, there is obviously a ton of anxiety and also not really knowing when this will be over. So sort of taking your experience with being a professional in this aspect, and then also helping so many people, for people, like me that are at home, what are some things that, what are the most common mental health issues that you're seeing arise, or do you anticipate will arise? And whatever those are, what can people do to sort of work through them or help themselves?
Sure. So we had a mental health and addiction crisis, an epidemic, prior to this pandemic. So there was something that was happening. We were having, we were having a death of despair from alcohol, suicide, or opioids every 3.5 minutes prior to the COVID pandemic hitting us. So we had a problem. Now, with the economic and social dislocation that's catalyzed by the COVID pandemic, we're gonna expect things to get harder. So if there's more unemployment, there's more social isolation, that's directly related to things like worsening depression, anxiety, substance use problems, and possibly deaths of despair. And I think, this is something that we're very concerned about, the second curve. We're talking about the first curve and everything that's going on. but there is the second curve that we're very concerned about. And you asked a really good question about what do we do about it? I mean, there's a lot, but I think starting off with turning to each other with kindness and compassion, and being there for each other is probably one of the most important and basic things that we should do. I would say there's a lot that we need to start, like people who are working from home, and how do you everything gets blended into one thing, and it's hard to maintain your work balance and your social life. And I think maintaining structure is probably
Mhm.
one of the most important things that one could do. And how do you maintain structure and getting up at a certain time, having your meals at the same time? The very basic things are important. I would say that it's really important for us to stay informed. So get good information, like you pointed out in the earlier part of the session, that there's CDC.gov and they're good sources of information. But also understanding that media can be very activating, and it can really cause us to be more stressed if we're constantly looking at stuff. So limiting your media time is something that would also be very important. So stay informed, but limit your media time, structure your day. And one thing that, it's, as a psychiatrist, I feel the word social distancing is actually unfortunate that that was what was chosen. I think it's physical distancing
Right.
while maintaining social connectedness. So the more
Right.
you can do to stay socially connected.
Yeah, that makes sense. I mean, it's interesting. I know a woman, and her father just passed away. He was older. He got COVID-19, and she, in a social media post, was talking about how crazy it is that she can't actually see her father and she can't grieve with anybody and everything, and I do think that when you look at it like that, it really is physical distancing. And then in that case, what do you do to help someone like that? Um, so I mean, you kind of did just touch upon my next question, which was what should people be doing, and what can people avoid doing, to sort of maintain a good mental health. But is there anything that you would add that people shouldn't be doing, possibly?
Stick to the facts. Don't be driven by irrational fears. Toilet paper is a classic example. I mean, you go in to a store, somebody's buying toilet paper, everybody's buying toilet paper, and you're buying way more than you need. You're not thinking about others who might need something, and that's driven by irrational fear. So I think kind of grounding yourself, understanding, what the facts are and how do you plan, because it is important. So like, think about fear and stress. These are normal, survival mechanisms. It served our ancestors really well. It sort of helped them survive. So
Mhm.
there is, it's understandable for people to have fear, but when it's fear with uncertainty, and you start getting overwhelmed with this. So I think it's really important to be thoughtful, to take care of your emotional health, plan, but again, stay informed, and base what you're doing on facts, not just a lot of myths that are out there.
Right. No, that makes a lot of sense. I think also one of the things that a lot of people are struggling with is feeling the loss of control. Sort of the toilet paper thing. It feels like people are focusing on things that maybe they can try to control, as a way to not really face what is happening, head on, or they don't really know how to deal with their emotions. Sort of dealing with emotions and everything, and sort of to what I was saying before about a friend of mine and losing her father. What can you do for people at a distance if you know that they may be struggling or they may be going through a hard time? And I think collectively we're all struggling in our own ways, but what can we do to help those in our lives that we aren't actually able to be with right now?
Yeah, no, that's so important. I think as something as simple as checking in on people, a simple phone call at this time. How are you doing?
Hmm.
We're here. We care for you. Can go a long, long way. For people, I've had a lot of friends and colleagues who've been checking on their elderly neighbors, and they actually are going and running errands for them.
Right.
And what they've told me is really interesting. They tell me that it helps them more than it might actually help them. It helps them feel more in
Like they're
control.
doing
To your
something.
earlier point, like, I want to do something, right? I want to do something that's meaningful, and they're finding ways to control. But I think to your earlier question, staying connected, trying to call people, calling your loved ones, grandchildren, grandparents, if they have the ability to have some video conferencing, I would schedule that. I mean, those are things that really matter, probably more
Mhm.
so than ever before.
Yeah, agree with you. Actually, just sort of on a personal level, my mom is sick, and when she was first diagnosed with her illness and everything, it was unbelievable how just getting a simple little text message asking how I'm doing, or just saying hey, meant so much more than, things like even seeing people. But, I can only imagine people feeling isolated right now, and just getting that text message or that phone call and just knowing people care definitely has to be a positive, and just a reminder that you're really not alone, even if you are physically alone right now. Now that we've sort of touched upon adults, what would, kids are really perceptive, and the fact that we're living sort of in the unknown. How do we comfort, you actually mentioned that you're working from home, and that you had said to your kids not to come in the room. How do we comfort, our children? Although I'm not a parent, I can again imagine that they're not going to school, they're not seeing their friends. This is just as hard as it is for us. It's obviously something that has to be challenging for them as well.
No, it is, and children are naturally trusting, and they're open, they're interested in the world around them, and they perceive things very quickly. So they see that people are scared or sick, it impacts them. So I think the most important thing as adults for us to do is to regulate our own emotions, because like you pointed out, they're very perceptive. They pick things up, and they're already sensing that there's something that's not right. So we need to regulate our emotions. We need to be very thoughtful, listen carefully, respond appropriately. And there can be other things that people do. So like when children think about, the person who's sick, they actually do very well when, I think it was Mr. Rogers is, one of his quotes where he talked about this, where, when children are dealing with folks who are sick, or the thing that works really well is if they focus on the helper. So, things that they can do to help, how can they send a message of hope and help, and then be a part of that, and they actually do well. So it's something that I tried with my daughters. They're, both under 12, and we create a little video expressing our gratitude to all the healthcare givers. And it helped them, it helped me. So I think there are little things that we can do, but I think regulating our emotions and listening carefully and being there with them is really important.
That makes a lot of sense, and I can imagine that definitely, I mean, this will be something that they look back on when they're older as being such a very odd, strange year, I'm sure, for all of them. So in terms of being at home and everything, I'm sure you've heard this already, and I've seen now a number of articles and a number of people discussing this. There might be some people that are in homes where there might be abuse. And, we're stuck at home right now. So what would your advice be for someone who is faced with, domestic violence or domestic abuse, or even not just someone who may be in that situation, but if you have a loved one or a friend, what would your advice be on, ways to help? And if you are someone who's in a situation where there is abuse, what are your options?
Yeah, no, that's such an important thing. It's so unfortunate, but very, very true. We've seen this in countries where lockdowns happened earlier, in Italy and in Spain, and we're certainly seeing that over here. People who are already predisposed to some level of domestic abuse, violence, now they're stuck in this confined space, and it's really hard. There's a lot. In fact, the United Nations Secretary General talked about this and has put out some statements. There are a lot of resources. I don't know if there's an easy answer, but there's domestic violence hotline numbers. We can share that, and I think being able to call and speak with someone who can then activate resources to help them. In Italy and Spain, as I was reading, what they did was they had hotels repurposed as domestic shelters for these individuals, and so we do need. This is a time for us to really make sure that we're taking care of some of our most vulnerable.
Right, for sure. And I think in terms of, I may be overstepping my expertise or whatever, but I think in terms of if you know someone who's in that situation, it is, without all of this, incredibly isolating. So I would imagine that checking in on them
Absolutely.
and reminding them that they're really not alone in all of this would be very impactful.
That's so powerful and absolutely true. I think just picking up the phone, checking in on people, especially when you're concerned and you know that there are things, you definitely should do that.
Yeah. So going on to more of a positive topic, I guess, in all of this, what would you say, or is there a silver lining? I do think that in terms of, or I would imagine that in terms of changes in telehealth and in advancements that, things have changed so much within the last few months. So I would imagine there has to be a silver lining. Eventually, hopefully this ends. So although we might have a new normal, what would you say, from a healthcare side, what would you say the silver lining is, if there is anything? And then also from a personal side for all of us, and all the people that are watching right now.
Sure. So it is interesting, the telehealth. So I've been with the telehealth division, for many, many years now, and things that we've struggled to do for the past 5 years, we were able to more than, double those efforts or triple them in some cases in a matter of 3 weeks.
Wow.
Staying with behavioral health, my field, it's a highly cognitive discipline, so it lends itself naturally to a video session. So you're speaking with someone, you can build a rapport, you can connect with them, you can provide therapy, you can do psychiatric assessments, you can provide medications electronically. Everything can happen this way, but yet for a variety of reasons, primarily billing, reimbursement, regulatory barriers, but then also just preference of the providers, we were lagging. And what's really interesting, so I'll give you examples, concrete examples when I think about it. So a new mom who's suffering from postpartum depression. Now, it's a very, very common occurrence. About 15% women suffer from postpartum depression, anxiety. Now you have all the other stressors that you have. You have this new baby, and then our old way of doing business was that this poor mom, you had to figure out childcare, do whatever it had to, come to see the therapist on a weekly basis, driving whatever distance, right? Now they're getting therapy at home. Everything is set. They're able to see their psychiatrist, get their medications at home. They're able to see their therapist at home. Patients with cancer and who are struggling with depression and anxiety. And it's really hard for them to get to the clinics and do this. They're getting care at home. So I think we had the capability to do a lot of stuff. We had a lot of barriers that have suddenly been lifted. Regulatory barriers have been lifted. Now, what is to be seen is how, what changes, what remains after the COVID crisis. I would be fairly confident to say that after a consumer of healthcare service has experienced excellence in a way of receiving care that is designed around your convenience, you don't have to drive, you can do it then we would be naive to believe that we would go back to business as usual after this is done. So I think there's a silver lining in transitioning, and I'm not saying every, modality of care needs to be delivered that way, but for where it's possible, we need to design care. So that's definitely happening, and that's already started. For outside of healthcare and thinking about the general population, when you think about it, I mean, as devastating as the pandemic has been, there's an opportunity for all of us to learn and grow, express our gratitude. Think about all of us, so many people who are able to work from home. You're not worried about your financial situation. You have your social life, you have family, you have a lot of things that you're not having to worry about. You're so privileged, right? And so embrace gratitude. And I think, despite everything, and we will overcome this together. And I think it's a lesson for all of us, things that we probably took for granted before.
Yeah,
not so much.
It's forced us all to slow down in a lot of ways. So I actually, just a random question that we hadn't really discussed before, but in terms of someone in your position, has it been different to not see patients in person?
So that is a good question. So for me, I mean, there are times where you do need to go into the hospital or emergency room. Like there are times when people do need to be in a safe space, like a hospital or an emergency department. But what we found is that by providing access, so if I'm able to reach somebody when a crisis is emerging, and I'm able to connect with them, and I'm able to walk through whatever's going on, I'm able to intervene effectively
Right.
before it gets into a crisis where I actually need to be there in person. So I'm not saying that everybody, can be treated this way, but I found that it's very satisfying,
I was
and
gonna,
I've heard from my child psychiatry colleagues that, and many others, that they're now, it's not only that they're connecting with their patients in a more convenient way, but they're now, patients are in a way letting them into their homes, into their lives in a different way.
yeah.
So now they're seeing them in their home surroundings. They understand what they're dealing with, what things look like for the children, meeting with the families in that circumstance, understanding what it looks like. It gives you a new appreciation of what people are going through, so that you can actually be there. And I think if you take a little bit, there's a little learning curve. We're so used to our body language and just being there and tapping somebody on the shoulder, and you're going to miss those things. But how do you overcome that by this? And we're learning quite quickly. So I feel hopeful. I feel very hopeful.
It has to be really rewarding. In terms of, helping the caregivers and everybody at Providence, what do you think, what would you say is the silver lining of all of this on that topic?
Yeah, so I think one of when I talked about the reactive care piece, that was one, but then the proactive, like, so healthcare has always been, healthcare workers are always, it is a very stressful thing. I mean, dealing with death and dying, we know that female physicians are more likely to die by suicide when you compare them, with others in the same demographic. So we've always known that there's a high level of stress, and I think what this will, what we're trying to do, and hopefully we'll be able to incorporate, is bringing joy back in medicine, and in caregiving, and incorporating this in the part of our normal daily workflow. Not one additional thing, not that thing on the side, but through the course of your workday, starting off with the message of gratitude, some mindfulness, and building that through your day. And I think as we get, that becomes hardwired through the next, whatever time this lasts. I'm hopeful that that will become the new normal for us, that we care for ourselves. Healthcare workers, when you think about self-care, that's the last thing that comes to your mind. They're not wired that way. So now forcing self-care to become important for them, that hopefully will drive some real change.
That's incredible. Last question, and you just sort of touched upon it in terms of healthcare space as sort of our new normal. When this pandemic is considered over, what do you think that we can expect that people are feeling and experiencing? But more than that, I guess, what would you say, how can people sort of deal with, now we're going to be faced with another change? What advice would you give to everybody when that day comes?
So the first part of your question, I think, like we talked about earlier, there's going to be a risk for some people to have more depression, anxiety in the context of social isolation, and unemployment and financial issues and everything else that's making things worse. The people who are on the front line of healthcare, whether they're EMS providers, whether they're ER nurses, ICU nurses, doctors, they're going to be at a greater risk of post-traumatic stress, given with all what they're dealing with. So we do need to be thoughtful and make sure that that's being addressed. For vast majority of others who haven't been affected by this as much, in terms of not facing death and dying every day, there's still other challenges. I think, like we discussed earlier, embracing gratitude is probably the most important suggestion that I would give. I think being very mindful, being appreciative of what we have, and going slow.
I think that is great advice. I think it's really important that we continue to, we take care of ourselves first, obviously, because that allows us to take care of other people. But that is our time. That went by so quickly. So thank you, Dr. Arpan Wagre, for joining us today. And to everyone listening and sending in your questions, to learn more about our initiatives, programs, services, and ways to give, please visit psjh.give.providence.org. If you are looking for help or medical advice, please visit providence.org and/or swedish.org, and make sure to follow us on social media at Providence Health System on Facebook and Instagram, and under @Providence on Twitter.